Welcome to the Birthful podcast. I'm Adriana Lozada, and today we're going to be talking about tongue ties and lip ties. If you have no idea what those are, you're in luck, because Dianne Cassidy is here to tell us all about them, along with why there seems to be a tongue-tie resurgence, how it can affect your best breastfeeding intentions, and what you can do about it. Stay tuned. This episode of Birthful is brought to you by the first 8 days of being a mom, a day-by-day manual on taking care of the new mom as well as her newborn. Get a 10% discount by going to thefirst8days.com/birthful. That's with the number 8, thefirst8days.com/birthful. The Birthful Podcast, talking to maternity pros to inform your intuition. Hello, mamas and mamas-to-be. I want to thank you once again for all the love you're giving the show and send a quick reminder to subscribe to the podcast on iTunes so we can get it in front of more mamas. If you want to go the extra mile, leave a review. I will be, as you know, forever grateful. So today I'm happy to have Dianne Cassidy on the show. Dianne is a lactation consultant in Rochester, New York with an advanced lactation certification. She works in private practice and in a busy pediatrics office. And in the fall of 2013, Dianne completed her master's in health and wellness lactation. Dianne became interested in lactation consulting after breastfeeding her own children, which includes a set of twins. She spent thousands of hours working with new moms and babies and has the unique ability to identify with their needs and concerns. Dianne has worked extensively with women who have survived trauma, babies struggling with tongue tie, those who have experienced birth trauma and are having milk supply issues, problems with attachment and latch, moms who are returning to work, and those breastfeeding multiples. She also teaches prenatal breastfeeding and childbirth classes in the hospital setting, is working on her second book, and goes around the world speaking to other breastfeeding professionals about how to support new families through their breastfeeding struggles. Dianne has 3 biological children, 3 stepchildren, and a wonderful husband, all of which I've met because we happen to live in the same city. Hello. Hi, Dianne.
Hi, Adriana.
How are you?
I'm good. It's so good to be here.
I'm so glad you're here. Even though it's cold. It's always cold.
I know. Thank goodness I'm cozy and warm in my house.
So, tongue ties and lip ties, what are they?
Tongue ties and lip ties. They give us such a problem, don't they? Breastfeeding. So tongue ties and lip ties have become a little bit more popular these days. I don't want to say popular to the way of, like everybody's got one, but I think with the internet, lots of new mamas are really doing a lot of research on their own and learning a lot more about stuff. And we're finding more and more tongue ties because these moms are really kind of taking charge and, trying to find out what their problems are. The tongue tie technically is the lower underneath the tongue. That is the lower frenulum. And it is just when it's underneath the tongue there, that little membrane that holds the tongue to the floor of the mouth that is formed very early on. The mouth is formed very early in utero, the first few weeks. And as the mouth is formed and the floor of the mouth kind of disintegrates away, it leaves this little membrane behind. For some babies, it's way back in the tongue, doesn't cause any problems. It's not an issue. For some babies, it might be a little bit further up. Might be a little bit short, it might be tight, it might be thick. It may or may not cause breastfeeding problems. Now, the lip tie, that is the upper frenulum, kind of like when you put your tongue up at your top teeth and you feel that little membrane at your top lip, holding your top lip to your top gums. That is your lip tie or your top maxillary frenulum.
And you know that right now we're all sticking our tongues in between our teeth.
Absolutely, because I was doing it too. So, yes. And whenever I talk to moms about this, or we talk about it maybe in breastfeeding class or something like that, that's pretty much the response I get as everybody starts to feel around for theirs. But that is when that one might be, again, short, tight, thick. Maybe it kind of wraps around. Some of them you might see wrapping right around into the palate. And those are the ones that can actually cause that space between the 2 front teeth and have trouble with your little one's teeth coming in.
The gap.
Yes, that's where you get that gap from.
Okay.
Mhm.
So why, let's start with the tongue tie. Why are tongue ties a problem?
Tongue ties can be a problem as far as breastfeeding, because there are other problems that go along with tongue ties. But tongue ties are a problem with breastfeeding because the tongue is an integral part of feeding. We need to have that mobility of the tongue. We need to be able to have the baby move their tongue up and down, around, move the milk back down into the throat, have a good, comfortable latch, have that good momentum with their tongue. If their baby is restricted, if the tongue is restricted, that's going to be more difficult for them. So it would just, I mean, the tongue is a huge muscle. So, I mean, imagine having a muscle that's restricted. How much can you do with that muscle? So it makes it a little bit harder, and babies try to compensate for that. But we might end up with pain for the mother, damaged nipples, painful feeds, um, problems with the baby getting milk because they cannot transfer efficiently. So we might notice really long feedings because it's taking them so long and they get so tired because they're using this restricted muscle. So we might notice that the baby's not gaining weight well. We might see that the baby is really struggling to hold onto the breast and to keep a latch. Sometimes you'll see those babies go on and off and on and off. They can only suck a couple times, and then when they swallow, they fall off. Um, we can see the painful, like I said, the painful nipples, but not only the painful damaged nipples, but we also see pain in the breast itself. It's called vasospasm, and that is caused from the baby compressing the nipple because they can't get that latch nice and deep. And they're just kind of crushing, they're pushing their tongue up and crushing that nipple right up against the roof of the mouth. So that can actually cause what we call vasospasm, which is like a burning sensation in the breast. And that kind of stays with you throughout the day. After the feedings, you're feeling that,
That sounds
not during the
horrible.
feeding. It is, and it gets diagnosed as thrush quite a bit, which is not, it's a wrong diagnosis, but it's got a lot of the same symptoms. So, sometimes I'll have moms call and say, I was diagnosed with thrush. I've been on medication 3 different times now. I mean, if the medication's not working, that's probably not what it is. So
Hmm.
then we start looking for other things. But it's horrible. It's awful.
Okay. Yeah, no, that sounds like it really affects a lot of the components of breastfeeding as babies try
Absolutely.
to compensate.
Absolutely. It can also affect teeth development for that baby as well, because the tongue does have an impact on how the teeth are developing and where they are. Also, if the tongue is restricted, you can't move your tongue around in your mouth as well. You're not able to clean your teeth out, or if obviously as the child is getting older, which causes more cavities, depending on the speech, or speech can be an issue depending on the tongue tie itself. Um, One of the other things it also causes is problems with the palate. So when your mouth is forming, as I said early on, the palate is also forming, and the tongue is what forms that palate. So if the tongue is lifting up, that is what's making up a nice round palate. And if the tongue can't do that and it's restricted, you're going to have a narrow palate or maybe like a high, deep palate. And that will also cause a lot of problems with teeth development as well.
So that's really interesting because right now we see tongue ties tied to breastfeeding. I hadn't even considered that that was something that could affect not just, problems with breastfeeding, but further along for the child as they grow up and into adulthood.
Yeah, yeah, it really can.
Wow. So what about lip ties? How do they affect things?
Lip ties can affect breastfeeding because the baby needs to have those lips flanged out. If you've ever seen a picture, you've seen those breastfeeding babies with their lips flanged out like little fish mouth.
Mm-hmm.
If the baby can't do that because of that tight top lip, because sometimes it is tight enough that it just holds it really closely to the gum line. The baby can't flange that lip out, they're not going to have a good seal at the breast. And if you don't have a good seal at the breast, you're not going to be able to transfer milk efficiently. You're taking in a lot of air with the feed. It might take longer for them to feed, harder for them to transfer the milk.
Is that one sign of that if you hear babies clicking when they breastfeed?
Yes, exactly, because they're losing the latch. It's falling off.
Now, is that clicking exclusive to a lip ties, or is it just, one thing that comes up with lip ties, but with other stuff too?
It's that clicking I hear with lip tie and tongue tie. But I've also heard clicking with babies that are struggling with an oversupply or a
Mm-hmm.
heavy letdown for the mom. So that would be like if mom's just got lots of milk, and when the baby goes to feed and all this milk just comes rushing down at the baby, and they're struggling to kind of keep up with that supply and keep up with that flow of milk, you might hear some of that clicking. And the difference being that you'll only hear that clicking with the letdown with a baby that is struggling with heavy supply. If it's a tongue tie, you're going to hear the clicking throughout the entire feed.
Awesome.
Yeah.
That's a great tip. So how can I mean, you've told us a little bit, but is there other signs or ways a mom can tell if her child has a tongue tie or a lip tie?
Some of them are very visible. You can see the tongue right up to the tongue tie right up to the tip of the tongue. Sometimes you can see it just a little bit further back, that little membrane, straight up and down, almost like a piano wire. You can see that right kind of holding the tongue. If the baby is not able to lift their tongue effectively, they really can't lift it up and they're not having full mobility with it, they may be able to stick their tongue out. It's kind of an old wives' tale, I guess, so to speak, or a fallacy that if the baby can stick their tongue out, they're not tongue tied. And that's not true. It really has to do more with the mobility of their tongue. If they can stick it out, they can still be tongue tied because they might not be able to move their tongue efficiently from side to side. So if they are not able to lift it up or move their tongue around, if the mom is having a lot of pain with the feeds, that's one of the things we look for. If the baby's not gaining well, that's one of the things we look for. Unfortunately, if none of those things are happening, because some babies can feed just fine without even, with a tongue tie, without anybody ever knowing the difference.
So sorry to interrupt you, but so those babies that can eat and gain and everything's fine and have a tongue tie, well, and then is it a problem, or does it just go away, or?
It doesn't go away. That might not be noticed until they need braces.
And then it's something that didn't affect breastfeeding, but might affect teeth placement.
Exactly. Yes.
Gotcha.
Yeah.
Okay. So is it now? I have heard the different classifications of tongue ties, and that some tongue ties, especially like I guess the posterior kind, get misdiagnosed or are hard to even know that they're there. How can a mom know that? I guess is my question.
You really have to know what you're looking for with the posterior tongue ties. They can be harder to diagnose. They're kind of hidden. Some are almost hidden underneath the muscle of the tongue too. We call those the submucosal. They can be really tricky. Sometimes with those, it's kind of, I don't want to say trial or error, but I almost seem like every other problem has been looked at and it's just not going away. There's either still pain there, the baby's not gaining well. You really have to be able to assess the baby's suck, because that's another thing that's going on. So if the baby is not, and the way I do it is I let the baby suck on my finger. And if the baby is like chewing or chomping instead of having a nice glide suck motion, that's telling me the baby is not coordinated with their suck and having trouble moving their tongue. If the baby's not able to cup their tongue around my finger, that is one of the other indications that there's a tongue tie there. Lip tie and tongue tie almost always go together, like 98% of the time they'll go together. So if a mom says, I think my baby's lip tied, automatically I'm going to look for a tongue tie with that baby too. So if they're posterior tongue ties, or what we call posterior tongue ties, those are further back, and there's more controversy with those because they are harder to find and they are hard to see. And if we see breastfeeding problems and we say, yes, it's a posterior tongue tie, sometimes that gets debated with, is it really a posterior tongue tie or is it a different problem and we're just calling it that? Which is why I think some people think that we've kind of overdiagnosed them.
Mm-hmm. And it makes sense, and because what you're saying of this is because they're hard to diagnose and hard to detect, then all other problems have been sort of tried first. So it's you've got a breastfeeding relationship that has had some conflict for a significant amount of time now, that when you finally get to the posterior tongue tie, it's like, yeah, well, what's it going to be this time? Do you find that that's the attitude that for those types of tongue ties?
Like for the mom, for the
Yeah,
family. Um, Usually the mom is so grateful to have an answer.
sure.
And once I talk to her about it, it's kind of like, oh my gosh, that's exactly what's happening. And it just becomes so clear that that's the problem. So it's more of a relief, I
Hmm.
think, than anything else. And I mean, sometimes they're found very quickly. Sometimes it's a baby that's not gaining well at all. And, the mom's doing everything she can, but the baby's just not gaining and there's lots of pain there. So it might be found within a couple of weeks, the first couple of weeks of delivery. I saw a baby the other day where the baby was a month old and everything was going really well. Um, for the first no month, actually 2 months old, I'm sorry, and everything was going really well for the first 5, 6 weeks, and then they started to see symptoms. The baby was starting to get tired, not feeding as well, taking a long time. Mom started to feel a little bit more pain with the latch. So it's variable. It really is. It can vary from baby to baby, and it can really just depend on where that tongue tie is placed.
So tell me a little bit more about that story, because I think that's really important for moms to hear that, breastfeeding was going fine and then suddenly things kind of fell apart.
Yep, breastfeeding was going well. Baby was gaining well, and she was then all of a sudden starting to have problems with the latch. Baby wasn't able to latch as well. She started hearing a little bit more clicking noises that she wasn't hearing before. She started to experience that the baby was eating all the time. And not just, I mean, all babies have those cluster feeding times of the day where they'll feed, 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 or those times where they're going through the growth spurt where they're just feed, feed, feed. But if your baby all of a sudden, from the start is just seemingly not getting full, they want to feed constantly, or they're falling asleep so much at the breast because they're just getting so tired out, or they're starting to take longer and longer and longer. And that's what this baby was doing. He was starting to get more tired and he was starting to take longer and longer. And mom was finding that those faster feeds were a thing of the past. And now she was starting to feed more frequently again. And looking further into it, she actually did a lot of that research herself and said, I think the baby has a lip tie. And then looking at the baby, he actually had a tongue tie as well. So I think she was relieved that was the issue.
Hmm.
But this baby was gaining beautiful. She has an oversupply issue. So that really masked any kind of gaining problems for this baby. It
Okay, and
was
do you think it was finally supply kind of leveled out, or baby grew enough that he or she could sort of match that supply, and then that the tongue tie was able to surface?
Yes, I think so, probably.
That's so interesting.
It really is when you see like how it plays out. It's so different for every baby too. It really needs to be looked at very closely. Like every case is individual. I can't just say, "Oh, you're having pain, it must be a tongue tie," because there's so many different things going on, and it really needs to be looked at individually, each baby.
Sure. So what's the oldest you've ever diagnosed a tongue tie?
Um, I've had a couple of moms call me and say, my daughter or my son is 15 months, 18 months, 2 years old, and now I'm pregnant again, but I think the baby, my older one had a tongue tie or a lip tie. Would you mind checking it out so I can be prepared for the next baby? Because it tends to be hereditary. If you see it in one, you tend to see it in the other children. And a lot of times, if I say, "Oh yes, your baby has a tongue tie," or I think this is a tongue tie issue, sometimes I'll hear one of the parents say, "Oh, I had that growing up," or, "Oh yeah, my husband said that he had that too." And so it is in the family line. It is hereditary. It's something that we look for in family lines.
Hmm.
So I remember seeing this one family, and they had a new baby and an older daughter that was probably about 2, and she, told me, "Oh, no, this is my first baby, breastfed beautifully, never had a problem." But she was struggling a little bit with the second baby. She thought maybe it was a tongue tie issue, which it absolutely was. And I said, "Well, can I take a look at your daughter just to kind of see?" It was probably the worst lip tie I've ever seen in my life,
Oh no.
and never had a problem with feeds ever. And she was like, "Oh my gosh, really?" Like, that, so thick and so tethered to the gum line that it was just incredible. It was the worst lip tie I've ever seen.
So do lip ties also affect other things aside from breastfeeding, like as they grow older? Like, is that something that you would recommend at that point, having them to take care of?
I would, because it can impact your teeth so drastically. So it can impact teeth because if it's so tight and thick like that, and the lip is really tight to the gum line, for little ones, especially that either don't brush well yet, or for the moms that are trying to help them brush their teeth, food gets stuck in there. And you find that those top teeth, even though they're baby teeth, are getting decayed from food being stuck in there. You also can get that space between the teeth. So it can impact dental quite a bit.
That's so interesting.
I did have a mom tell me once that her son had one so bad and she didn't have it clipped, or maybe she just didn't know during the breastfeeding time, and then she found out when he was older and wasn't sure about going through it as he was older. But she said that it just kept ripping every time she would try to brush his teeth. It was,
Oh,
so it can be a struggle as they
yeah.
get older if you leave it. Some babies will break them on their own, like if they fall or they bump their mouth. My son actually did that with his. And come to think about now that I know everything that I know, my son did have a very thick tongue tie, or lip tie, I'm sorry, very thick lip tie, never had breastfeeding problems with them. But I remember when he bumped his face on his crib when he was a baby and it broke, but he still ended up with the space between his teeth because it didn't take care of that membrane down underneath going into his palate. So we're, like 3 years of braces now.
So tell me a little bit about, or let's move on to how to address and take care of a lip tie and a tongue tie, since you've mentioned clipping and breaking. And so
Awful
since you've
sounding
teased
things
us with
to
those
say.
words.
Sounds awful. And nobody wants to hear, "Oh yes, go have your baby's tongue clipped." It sounds horrible, to everybody involved. It depends on the tongue tie, and it also depends on where you are in the world. Different places do different things. Different doctors recommend different things. Here where we are, I tend to, if it depending on if the tie is really causing problems, if it's a weight gain issue, if it's a breast pain, breastfeeding, mom is really struggling. Mastitis is another thing sometimes that we see happening over and over again. Mastitis, breast infections, because the baby's not draining the breast well. Things like that are starting to happen, then I would recommend that the baby does get it clipped. If everything is going well and mom is comfortable with it, then that's, completely up to her with what she wants to do. The process for it, depending on the tongue tie and depending on the age of the baby, and I can really only speak to what I know here in Rochester, what we do here in Rochester, New York, but babies with a tongue tie that is midline, kind of midway between the tongue and the back of the middle of the tongue and the back of the tongue. And the ones that are closer to the tip of the tongue and maybe a little bit further back than that, those can be clipped just as an outpatient thing in an ear, nose, and throat doctor, by an ear, nose, and throat doctor, an ENT office. Our pediatricians here don't do them. So it would take another appointment to an ENT where they would assess it and say whether or not, yes, we should clip it, or no, we shouldn't clip it, or whatever their recommendation might be. The ones that are posterior, that are further back in the mouth, those are harder. You can't really clip those as well. It's not as efficient to clip those. We do have a doctor in Albany, in New York, here in New York, who will separate them using a laser. That is something that's kind of popping up, I know, around the country. There are several dentists. Actually, he's a pediatric dentist. There's several pediatric dentists in the country that will do it by laser. And that's a preferred method for a lot of people because it's quick and there's really not a lot of healing time, and it cauterizes the wound, and babies go right on the breast afterwards. So if your baby is older, maybe older than 4 or 5 months, it would be harder for them to clip a tongue tie in the office just because the baby gets so wiggly at that age. They're very distracted, they get wiggly, and you can't really hold them still. So they may recommend that the baby gets put under anesthesia. Fixing a tongue tie sooner rather than later is definitely best, because the baby really has to learn or relearn how to use their tongue. It's been restricted for so long that they have to get that mobility back, and they have to relearn how to use their tongue. And the longer you wait, the more difficult it becomes.
And that makes total sense. And I mean, and not only for the baby, but also the difference between having your baby put under anesthesia or not, that's a huge difference. That's a huge, difference.
It's a huge difference. And they said it's kind of controversial. So sometimes, a lactation consultant might say this is a problem, or the mom, like I said, might find it herself on her baby, and she might not get an ENT to agree with her. So it can be sometimes a little problematic.
So now I'm going to try to break some myths that might be myths or not myths also in my own head. Yeah. How true is it that when babies are really small, so less than 4 months, that they actually don't have nerve endings in that area, so that clipping in doesn't bother them?
It should not bother them. There aren't any nerves in that. It's just a little piece of membrane.
So, but as they grow, do they get nerve endings there, or those don't develop?
I have never heard that before. And in all the reading and the research I've done with it, I have never seen that.
Myth busted.
I know. I would say no to that.
Okay. What about, speaking a little bit to what we used to do before the 70s, when formula feeding became more of the way to do things. And that, was it true that lip ties were still around, and then it was something that the nurses or the midwives very much took care of right away?
Yes, that is definitely true. So like I like to say, back in the day, even the older school OBGYNs, I think, the midwives kind of got a reputation for clipping them right away as soon as the baby was born. If they were seen, they would take care of it. But older OBGYNs would clip the cord and clip the tongue just automatically and release them.
Wow.
Yeah.
At the set, like clip the belly button cord, the umbilical cord.
Clip the tongue. It was done right away, and it's just not even noticed. Nobody knew the difference. Or the mom, I have had moms say, oh yeah, I knew, that happened, or that's when mine was fixed. My mother told me that's when mine was fixed. And, but it was way back when. And then way back when, probably the 80s, 70s, when formula feeding became more on the rise, that's people just kind of switched to bottles when they started having problems, because babies could bottle feed. Some babies, even with a tongue tie, don't bottle feed well. So that can definitely be a problem. I have had some babies that don't bottle feed well with a tongue tie at all. So mom was really desperate because it's hard to get food into this baby. But that was kind of the excuse back in the 80s, when it was the popular thing to formula feed. The 70s and 80s was, well, you can bottle feed. Mm-hmm. As breastfeeding became more prevalent, I think more and more women started to find answers for their breastfeeding problems, and we're seeing more of it. Mm-hmm. I think that's one of the reasons why we see more of tongue ties now, because of that.
That now we're just more aware of them, and before it was something that the medical profession was aware of and took care of.
Right. Yeah, and now we're more aware of it.
Mm-hmm. So can you speak a little bit more to, you mentioned it quickly, but about the healing from a tongue tie, and does it matter which method is used in how that affects the healing?
It really depends on the tongue tie itself. If it's one that's, closer to the midline, closer to the front of the mouth, as far as the tongue tie, it's a pretty quick clip. What they do, from what I've seen, because I have witnessed them being done, I've witnessed that, and I've witnessed the laser being done. All they do, they snip it. They do put a little bit of numbing, or I don't know, whatever you want to call it, the lidocaine. They put some of that on in the baby's mouth, so that if there is any pain, that's, takes care of that. But there is no nerves in there. There's no nerve endings there. The baby is more, they have to restrict the baby. So either by swaddling or holding the baby down. So I think that really is more of the issue. The baby gets mad for that.
Mm-hmm.
Very quick, only, a couple of minutes, a very quick procedure. And the baby goes on the breast right away. There is no like hold time. There is no, okay, wait 20 minutes before you feed or anything like that. We want the baby to go on the breast right away. Of course, we know breastfeeding is great, has pain relieving properties, is calming for the baby. It's just, very, very therapeutic for them to be there at the breast. So right away, put the baby to the breast. And usually the moms notice a big difference right away. Once at home, there shouldn't be anything really. Maybe just watching the latch, making sure that the baby is feeding okay. The baby might feed fine for the first 24 hours and then kind of revert back for the second 24 hours, depending on how long this baby struggled with the tongue tie. If it's a 2-week-old baby, they're going to bounce back a little bit faster than that 2-month-old baby. So that's why I said before, you want to get that done sooner rather than later if it's recognized. Really just kind of keeping the baby close to you, lots of feeding when you can feed the baby, lots of skin to skin time. And there really isn't much else that you need to do. With the laser, they recommend tongue stretches, which most parents hate to do because that
sounds awful.
Yeah, that involves like going in the mouth and like pushing on the tongue and stretching the wound. And of course the babies hate that. But that's involved if the tongue tie is further back and posterior.
And why are those necessary?
So that it doesn't reattach, because they can reattach.
Because it's so further back and like underneath the tissue and
yeah.
Okay.
Now the lip ties can be a little bit more of a challenge. They might need a little bit more, wound closure if it's a thicker lip tie. So sometimes with those, they're not as willing to clip those right away. Sometimes they'd rather wait until the baby's a little bit older for those. So lip ties are a little bit more of a struggle to get fixed.
So how old is older?
Maybe a year.
Oh.
At a lot of ENT offices in our area.
Okay. Even if mom's having, like, if that's causing all that clicking and suction problems?
Sometimes, yes. Sometimes we can manage to get them done, but sometimes, yeah. They will do the lip ties by laser, but
only by laser.
There's one ENT in our area who will possibly clip a lip tie on a baby. The rest of them usually like to wait until the baby's about a year, but laser they will do anytime, any age of the baby. They will do laser on lip tie or tongue tie. Okay.
Well, I might have to have you have the oldest diagnosis that you've ever had on tongue ties, because I know my daughter has a lip tie, but this is something I learned, like you say, after I learned all these things and knew better, and not when we were breastfeeding. We had tons of trouble because of it, but I didn't know better. So she does have a lip tie. And I could hear her clicking when she breastfed.
Ooh.
It was all the time. She was like,
yep, that's it.
But she would be a really good, like, she would feed very quick and swallow, and she never had weight problems.
You probably had a good supply, yeah.
But it didn't last long, our relationship, because she started, once she got a whiff of a bottle, that was so much easier that she was done. And I didn't know better than to call for help, which is, totally on me. She's going to be 10 soon, so...
I'll definitely take a look at it. There would be some times where my husband laughs at me. Well, we'll be out talking to somebody in public and I can't get past the fact that they've got a tongue tie.
Mm-hmm.
Like I can just see it because I look for them now on
Mm-hmm.
everybody.
Well, especially if it's that very, the front, the
Yeah.
short, where you can see the tongue almost go into a heart shape.
Yes. Now, one thing I did want to make sure we talked about
Mm-hmm.
is nipple shields, because nipple shields are used a lot with babies that have a tongue tie. And that is because it can really help the baby to maintain a latch. It can really help if mom's having a lot of pain with the feeds. Sometimes moms will call me and say, I've got a or I'm using a nipple shield. They gave it to me in the hospital. And I was, well, why are you using it? Well, the baby just wouldn't latch. So they gave it to me and the baby latched fine. That's usually kind of a red flag that goes up in my mind about, okay, is there a tongue tie here that nobody noticed? And that's why the baby wasn't able to stay latched? Or is it something that happened, during labor and delivery? Fentanyl, which is one of the medications used in epidurals, which is a whole different talk, but that will actually cause some problems with sucking and with tongue coordination. So sometimes that might get mistaken for a tongue tie in a very young baby. So have to kind of take a look. Okay, has this nipple shield been introduced to this mother for a tongue tie problem, or has the nipple shield been introduced for another reason? Sometimes I'll get those moms that come to me with the pain already and the baby not staying latched and things going wrong, and we'll use a nipple shield until we decide what the course of action will be, and the baby will feed great. So it's okay to use them. There is a lot of controversy surrounding them as well, but if it helps the baby to feed, and until we can figure out what the problem is or get it fixed, then that can really be a huge help for some mothers.
So use it more as a tool than an end game.
Absolutely. Absolutely.
Cool.
Yeah.
And I might just have to have you back here at some point to talk about how epidurals affect breastfeeding, because that's, as you say, a whole different can of worms, but so interesting.
It is interesting, really, once you get into the nitty gritty. Both of these things, the tongue ties too. But once you get really into it and you learn a little bit more about it, and it's like, wow, this really does have a huge impact on breastfeeding for these babies.
And that's why we geek out on it.
Yes, I know. It's
Birth
crazy.
geeks.
I know. I know. I love it.
Good. Well, so, okay, this was all fantastic. How can listeners get into contact with you if they want to know more, or, get your services or read your book?
They can contact me via email if they want to. I would love it. I do have a website as well. So it's Dianne Cassidy Consulting, and it's Dianne with 2 N's and an E. My mom did that to me, or she gave me that extra N in my name. So 2 N's and an E, and Dianne Cassidy Consulting is my website. And same with my email, Dianne Cassidy at rochester.rr.com, or people can just email me right off my website as well. And I can be reached by phone, and my phone number is right on my website. I also have a Facebook page, Dianne Cassidy Consulting. I put tons of information on there, lots of great informative things for my moms to see, whether it be about tongue tie or going back to work or pumping or whatever happens to be the thing of the day that I find. I do put lots of great information up there for moms to see. So it can be a good resource as well.
Fantastic.
My book you can find on Amazon. That is the one that is out now, is Breastfeeding and Trauma. It is about all sorts of trauma that a mom might experience. It could be domestic violence and how that impacts a breastfeeding relationship. It could be about sexual abuse and how that impacts a breastfeeding relationship. Birth trauma, how that birth either affects the baby's ability to breastfeed or the mother's ability to breastfeed. So there's a lot of really great information in that book as well. And then the one I'm working on now is about epidurals and breastfeeding, and that should be out in the summer.
So let's have you back here when that one comes out.
Absolutely.
Yeah. And your mantra, and I know it's your mantra because I tell everybody that you've told me this, so I share it. I love if we can say your mantra, which is that breastfeeding shouldn't hurt.
Breastfeeding should not hurt. It should not hurt at all. If it hurts, we need to look at what's going on there. And the other thing that I want moms to remember too, it should be my other mantra, is that moms are doing nothing wrong. So many times moms will call me and they say the the feedings are painful, I know I must be doing something wrong. I know I must not be doing the breastfeeding right. I know I must not be latching the baby right. And I want our mamas to take that off their shoulders. We just need to find out what's wrong. It's nobody's fault. We just got to find out and fix it.
Thank you so much. This has been fantastic.
No problem. Thank you. It's been great.
Mamas, I love to hear from you. So share with me your thoughts. And if there's a certain topic you'd like to know more about, let me know. Stay in touch by following Birthful on Facebook or Twitter. Even better, become a part of the Birthful community by subscribing at birthful.com. You'll get access to bonus episodes and other exclusive goodies. I'm Adriana Lozada. Please join me next week when I'll talk to another maternity pro here at the Birthful podcast. Thanks so much for listening.